Good evening, guys. This evening's topic C is end stage dementia at nearing the end of life. Okay, so we'll discuss that for C. So please enjoy my presentation I made for you. Here we go. Reaching out to their healthcare team or a hospice provider early can give clarity, support, and reassurance about what you're seeing and how to keep them comfortable. What the headline is pointing to. The page outlines gentle expected changes that often appear in the final stage of dementia as the brain and body gradually conserve energy. These signs aren't framed as emergencies, but as indicators that the person is shifting into the body's natural shutdown process. The emphasis is on comfort, dignity, and presence, not not on prolonging life through invasive or exhausting interventions. 10 signals, 10 signs the page highlights. Each sign reflects the body's decreasing need for energy and its reduced ability to maintain functions that once felt automatic. Prolonged sleep, long stretches of sleep or unresponsiveness as the body withdraws from from stimulation and conserves energy. Reduced appetite and thirst, a natural slowing of digestion and metabolism. Forcing food or fluids can be uncomfortable or unsafe. Dysphagia and aspiration risk. Swallowing becomes less coordinated, increasing the chance that food or liquids may enter the airway. Terminal restlessness, brief periods of agitation, fidgeting, or picking at bedding that often reflect internal changes rather than emotional distress. Cheyenne strokes or irregular breathing, rhythmic cycles of deep breaths followed by pauses. These patterns are typically not painful and reflect neurological changes. Fading speech with preserved hearing. The person may speak little or not at all, yet still respond to tone, familiar voices, and gentle touch. Episodes of episodes of confusion or delirium, sudden shifts in awareness, sometimes with hallucinations or disorientation that can come and go. Rare terminal lucidity, brief, surprising moments of clarity or recognition that can feel like a final emotional gift. Circulatory changes, cool extremities, molting or pale skin as blood flow prioritizes vital organs. Muscle and con- uh, continence changes, increasing weakness, difficulty responding, and loss of bladder or bowel control as muscles fatigue. What these changes mean for care. The page underscores that these signs are psychological, not uh, failures of caregiving. They signal that the body is doing what bodies naturally do at the end of life. The focus shifts toward comfort centered care, reducing discomfort, easing breathing, and creating a peaceful environment. Gentle communication, speaking softly, using familiar phrases, and assuming they can still hear even if they cannot respond. Non-burden, non-burdensome support, mouth care, moistening lips, repositioning for comfort, and managing agitation with guidance from clinicians. Emotional presence, offering reassurance, music player, or silence depending on what feels right for the person and family. Practical steps for families and caregivers. These signs can feel overwhelming, but they also offer a roadmap for what to do next. Talk with the clinician or hospice team about what you're seeing and how to manage symptoms gently. Avoid forcing food and fluids, which can increase discomfort or aspiration risk. Use calm, simple language, even if the person doesn't respond. Hearing is often the last sense to fade. Prioritize comfort through soft blankets, familiar music, dim lighting, and unhurried touch. Ask the care team about managing restlessness, breathing changes, or pain so the person remains peaceful. These steps help families shift from fixing to accompanying, which is often the most meaningful form of care at this stage. That helps you advocate for comfort, dignity, and calm in the days ahead. As dementia progresses to its final stage, signs such as increased frailty, uh, disease, decreased appetite, communication difficulties, and changes in breathing often indicate that a person may be nearing the end of life. Key signs: increased physical weakness and frailty, individuals may become extremely weak, bedridden, or unable to sit up or hold their head without support. Muscle mass deteriorates, then they may sleep most of the day, conserving energy as organ systems slow down. Gentle repositioning, soft pillows, and maintaining a comfortable environment can help provide comfort and prevent bed sores. Severe communication difficulties. Speech may speech may diminish to unintelligible sounds or stop entirely. Nonverbal cues such as facial expression, eye movement, or body tension may indicate discomfort or pain. Caregivers can continue speaking gently, playing familiar music, and using touch to maintain connection. Decreased appetite and weight loss. A significant reduction in food and fluid intake is common. Forcing eating can cause distress. Instead, offer small amounts of favorite foods, ice, chips, or moistened swabs to maintain comfort. Difficulty swallowing, dysphagia. Swallowing may become challenging, increasing the risk of choking or aspiration, pneumonia, elevating the head during meals, offering thickened liquids, and providing regular mouth care can help reduce discomfort. Changes in sleep patterns and increased lethargy. People may sleep 20 or more hours per day and appear unresponsive. When awake, terminal Terminal restlessness or hallucinations may occur, which can be soothed with gentle reassurance and calm environment. Change in breathing patterns. Breathing may become irregular, shallow, or include periods of apnea. A death rattle may occur due to secretions in the throat or chest. These changes are part of the body's natural shutdown process. Skin color and temperature changes. Extremities may become pale blue or molted and feel cold due to reduced circulation. These changes reflect the body's prioritizing blood flow to vital organs. Incontinence and bladder kidney changes. Loss of bladder and bowel control is common as muscles relax and kidney function declines. Urine output may decrease or darken, signaling the body is nearing the end of life. Okay, folks, so that is it for shows for now. I might be back on later for D. I will try and jump on after dinner. See you guys later for shows. For now, Gator Wellness. Take care, folks.